So I'm going to focus on giving consumers information to help them choose high quality health plans that best meet their needs. There's also a whole lot of education piece to be done about how to use those health plans once you have a similar set of knowledge in some cases, but I'm focusing on the choice of health plans. I really don't have much to recommend that's different from what I said when I spoke to this panel 3 years ago. But I can tell you a little about what progress we've seen since then and what we think still needs to be done. And the basis for our record is we're a nonprofit organization that produces for more than 40 years, produce websites, publications, etc. Rating all kinds of services, including doctors and auto insurance, all kinds of stuff. Most relevant here, though, and I should say none of those carries any advertising. It's supported by consumers, which is kind of nice to make sure that somebody finds it useful.
Sorry, we're having a little trouble hearing.
Yeah, we're
I can't hear
having
trouble hearing, so sorry.
Can you speak up?
Yeah, the whole sound system is down, so.
In the whole building.
So now I'm just I'm on
Yeah, yeah, they're working on it.
Whole
my own.
building.
All right, I'm on my own. Okay. So, anyway, we don't make any money from insurance companies or anybody like that. Most relevant here is our research and user feedback we've had over the past 36 years as we produced Checkbook's Guide to Health Plans for the 8 million employees and retirees covered by the 250 plus plan in the Federal Employees Health Benefits Program, which was really the largest pre-ACA exchange. Dozens of agencies have subscribed to their employees to help them choose plans: HHS, Department of Labor, Federal Reserve, Social Security Administration, etc. We've also written a lot about this subject and have built and hosted plan comparison tools to serve consumers choosing insurance in exchanges this year, serving 5 different states. We've written a lot about and spoken widely on the features that we think are needed in a tool, and key features that we think are needed are, first of all, a total cost, a single dollar amount, total actuarial estimate, average total cost, premium plus out of pocket for people like the user, same age, family size, health status, and possibly other characteristics. Boil it down to a number. We think they need to see the risk of a high cost, the total cost you might experience in a very high expense year, bad things that could happen, and the likelihood someone like you will have such very high expense years. You need to be able to see which doctors are in each plan. Part of the health plan provider directory where you can enter doctors' names that you want to have, and it just lets you see which plans are in and which they're not in. And also it'd be nice to have a sense of the general availability of doctors in each plan, how broad their networks are, just in case there's a doctor you've never thought about that you will need to launch. And there should be some kind of plan quality comparison, a summary rating of each plan's care and service quality, but allowing you to drill down for details beyond that summary and personalize the summary score according to what plan dimensions actually matter most to you. Because different things will matter differently to different people. Cost is a big challenge. And just a list of deductibles, co-pays, out-of-pocket limits isn't enough. That's what healthcare.gov had up for the first 2 years. And even, I don't care how smart you are, you can't figure out what that really means in terms of cost to you. You don't know the probabilities of your needing care, you don't know how much that care costs, etc. So you don't know, is a plan with a $200 deductible and a $10,000 out-of-pocket limit better for me than a plan with a higher deductible, let's say $1,000 or $2,000 deductible, and a $4,000 out-of-pocket. You can't figure that out. Now you throw in co-pays, co-insurance, etc., and you're lost. Another thing that's not enough is what we call a known usage model. And that model compares plans by asking the user how many doctor visits, prescriptions, etc. do you expect to have next year? Totally ignoring the very expensive heart attack or auto accident that you don't expect and that is a major reason for insurance. So that doesn't do it either. It's also a lot of trouble to fill out all your predictions of your healthcare company. The model we've used for 36 years calculates for each plan a single dollar amount actuarial estimate of average out-of-pocket costs for people like you. The Medicare Plan Finder tool a few years ago adopted a similar model. We use population data on healthcare usage and expenses of tens of thousands of consumers from the Medical Expenditure Panel Survey database and from some other sources to do this. And we run those different probabilities of different profiles of use against the benefit package of each plan and come up with a weighted average for somebody like you. Let me just say that there are simplifications that some tools make that really are in many cases not helpful and sometimes misleading. The federally facilitated marketplace for the first two open enrollment periods sorted plans on premium, implying that this was the right basis for choice. And yet we have hundreds of examples, thousands of examples, but in 2014, for a specific Chicago family, the plan with the lowest premium was a Blue Cross Blue Shield plan with a $93 premium. But another Blue Cross Blue Shield plan with a $222 premium could be expected to cost such a family about $2,500 per year less when considering premium plus out-of-pocket costs. And the same kinds of problems you have with other shortcuts. Deductible, I'll go about deductible. Well, it doesn't work. We need this actuarial estimate, total out-of-pocket cost plus premium. Sorting plans on metal level and other shortcuts are equally, they just don't cut it. Another problem that we've seen in the first few years was everybody thought, well, this is so complicated, we're going to help you filter these things down so you get down to a short list of plans soon. And the problem with that is, of course, if you filter out plans that may be the best plan for you, you don't even know you did it. So you say, well, I want a plan that has my doctor, not knowing that it's costing you $4,000 more than the alternative. I really don't care about that. Doctor, I can't even remember his name. So you just don't want to do that. And the idea of allowing for only a few standardized plan models, something that California has been a leader in doing, I think has some virtue in terms of simplifying things. But obviously it restricts innovation a little bit, but I think more important, you still have to compare those models. You have to compare 25 plans that are in Model 1 to 25 plans that are in Model 2, and those have to get you to all these out-of-pocket cost estimates and everything else because they're different. So I want to say that we have seen some progress in the state marketplace websites and the federal website. They were very unhelpful in the first open enrollment period, lacking all the key features we've been recommending. It was so bad that we set up and hosted our own tool as a model in Illinois at very substantial unreimbursed cost to us, just because we felt there had to be some model out there in the real world that people could see. That tool, it turns out, won the Robert Johnson Foundation's Plan Choice Challenge Award. And the features we recommend, and that have been recommended by others like Consumer Reports, like Lynn Quincy, who unfortunately is not here, have been picked up by various exchanges. But there's still a lot that's needed. The healthcare.gov website does have a total cost estimate feature to it, but we know that it's more like a known usage type model. You're sort of predicting what's going to happen in the coming year, and again, it doesn't adequately take into account accidents and other kinds of health problems. It's a prediction. I mean, it's all predictions, but it's not a probabilistic prediction. Healthcare.gov also doesn't let you see a high healthcare cost year alongside your the average year, and you really need to see both those things simultaneously. It's not hard to see them both. You can't see a large number of plans on healthcare.gov. This is true of most of these state exchanges also. By scrolling just down on the same screen and see 40, 50, 60, 100 plans, you should be able to go through those very quickly, because if it's done right, you can actually say, I don't want that, I don't want that, I don't want that. It's pretty easy to go through them. The healthcare.gov version in most states will not this year have quality measures in it. I think it'd be nice to have quality measures. We are moving in that direction. I think that's a good thing. You can see whether doctors you want are in each plan, but there's no measure of overall network depth, and I think that's quite important also. Whoa! Okay. Well, interestingly, I have one other thing I want to do. I want to give you a little show through of a model tool that we have. Okay. So I'm not sure I know how to do that, so I can have all the sound I want if I don't know how to do it. There was supposed to be a keyboard here. Is that someplace?
The system is rebooting. There we go.
Is there a keyboard someplace?
Yes, it's in the drawer.
Oh, in the drawer? Oh yeah. Ah, yes. That's good, because I can't get as close to the microphone anymore. Okay, so, right, and I've already partially filled this in. I'm going to go back a little ways, and it will erase part of it, sadly. But yeah, so I'm actually showing you, since we were talking about Missouri, showing you what we put up in Missouri. And one of the things we do is to have audio visuals, because we know a lot of people would rather learn stuff that way. But you'll see that this
Welcome to your health plan comparison tool. Choosing the right insurance plan is difficult and confusing. This tool is designed to answer the question, which are the best plans for someone like me, regardless of your knowledge of insurance. Tell us a little about yourself, and in just a few minutes, we'll find the best plans for someone like you. Rank them by lowest expected cost, that's premiums plus out-of-pocket, and report on plan quality, benefits, participating doctors, and more. Just click the Continue button to begin.
The most important parts of that are, first of all, videos are a good thing, and we have them throughout, because a lot of people want to learn that way. Second of all, she says in just a few minutes. That's a very big deal. And the third thing is she says, and you don't have to know a lot about insurance, which is a very big deal. People don't want a lot of time or a lot of knowing about insurance. So you want to find a way to figure out the most important things to show people, make sure they see those things, they understand those things. And that's one of the hardest challenges we always have, is what we're not going to include, what we are going to include, because you want to get them through it quickly. And we actually have a whole tour of this thing that people can take, but that takes about 8 minutes, and I'm going to take, I hope, less than 8 minutes to do it myself, although that's... age, but another very important thing is self-reported health status, where they can choose excellent, very good, good, fair, or these happen to be questions that people answer in the medical expenditure panel survey. Over the course of 2 years, actually, answered 5 different times. But we can, but we find those are very powerful predictors of usage. So age and the answer to that question are very powerful predictors for our actuarial model. We can also find out if they have certain major procedures, and some people, that's something that people can predict, or we choose the ones you can predict. Okay, some people will choose those, so that's nice. I'm not going to choose any here, and then there are a couple of other things that have to do with whether you're might be eligible for subsidies, whether you might have a premium adjustment or something like that, whether you might be eligible for Medicaid. And then we ask, which you like to find out if you can get health paying for coverage? We're going to say yes here. To do that, we have to find out whether the people in the family are covered by employer coverage, and we're going to say no. And then I'm going to give them a family income, and then they click here, and they actually see that this household, the two adults, have a $369 subsidy. We're eligible for a $369 subsidy. The two kids actually are eligible for Medicaid or CHIP, and we will tell them later on how to get into Medicaid or CHIP. But these two are really what the rest of the rest of what I'm going to present deals with here. But I'm going to also give a few doctors' names so that.
They're in there.
You're there.
On the right side. Here's what's up.
They can put in more doctors' names, they can put in not at all, it's up to them. You can see we're giving them a lot of warning here about if this really matters to you and you're choosing a plan based on this, call the doctor. Even the doctor said, no, the doctor may not be planning to be in next year. And also call the plan if you can. Try to trace this down. And then we go on to the near finish line in a sense. This is the comparison of plans. And in this case, we have 44 plans available to this person in this zip code. And you notice that the highlighted column is yearly cost estimate, estimated average total cost for people like you, including in and out-of-pocket costs. That very thing I was talking about, that actuarial estimate we were talking about at the beginning. And you can see as you scroll down here that's about 4,000 at the beginning, and it gets up to about 9,000 at the highest cost of the plan based on this. You can also see, and again, you see these little TV screens. Those are videos that will explain all this stuff if you want. Then you see cost in a bad year. That's that high healthcare usage year, and it doesn't always correlate with the average cost. And so people need to be alerted to that. Sometimes it jumps up a lot, even though the average cost is pretty low. Then we have a quality measure on it. We'll come back to that in just a second. And then we have the doctors of the ones you named, which ones are in each of these plans. So Castro's in those first two. None of the three is found in this coverage plan, and so on. This plan, this United Healthcare plan, has all three of them. Then it's the percent of doctors. We also have this little bar graph that shows the percent of nearby doctors who are in the plan. That's actually, we take all of the doctors within 10 miles of where you are. 30 seconds. Okay. We take all those and calculate a ratio of the ones in your plan versus all the doctors. And in a rural area, we might look at 50 miles or something. I just want to illustrate two things without really going into them. If you want to personalize the quality rating, we put all the weight on overall rating by surveyed members as the default. Okay, but you could pull up. I can't make that move. Well, if I did move these sliders, you'd see those scores change. I just personalized and the scores and those star scores would change. The last thing is I just want to say, if we were to sort by premium, notice again is that $4,000 is the lowest cost. If we were to sort by premium here, the plan with the lowest premium is $92. It has a $6,750 total cost. So it's about $2,500 more expensive than the plan, than the truly what we think is the actually estimated lowest cost plan. And people can click down for more details of these plans. You can see a bunch of plans side by side.